The meeting is being recorded. If anyone is recording the meeting on their own, please notify us now. Right. Open the meeting, move to open the meeting. Right, vote passes. Right. So so we're just going to open up the public comment. Anyone, please notify us if there's anyone that to speak.
Hello, yes, please. I would like to speak.
All right.
Yes, go ahead.
Recognize.
Hello, I'm contrary to what the screen says, my name is George.
All right, George.
I had some difficulty changing it. Hello, good evening. I'm come on behalf of Local Power. Our company, we're based in Williamsburg, Massachusetts, so somewhat south of you. And we're working on a sort of alternative waste disposal project. Build a facility, and the idea essentially is to be able to dispose of waste, municipal solid waste, in a more sustainable way than the current options locally. And so I'm just here to ask if you would be interested to have a presentation which would go into detail about this project.
So who takes care of waste management?
We
That'd
can
be the
ask
public
him,
works.
yeah, I
or-
think maybe ask him to send an email with everything.
Yeah, so that-
And then we can decide from there.
Yeah, so I mean, it'd be interesting to have information. And I think that would be a good idea. So, and then also, are you looping in Public Works? And
Well, we were just sort of starting with boards of health, in a way to sort of give background on the current system and its sort of limits in terms of health issues. And then we were seeking letters of interest that we would then move to other parts of government that are often less accessible. But if you think it would be better to start with the DPW, I'm happy to do that.
no, send us some information.
Okay.
And if it looks like something that we want to have more information on, we'll reach out to you for a
Okay.
presentation if that sounds good.
Or otherwise, we could redirect you to who we think the most appropriate body is.
Right.
Okay, that would be great.
Awesome.
And what email should I use, sir?
You can use Michael, MICHAEL .Theroux, THEROUX at greenfield-ma.gov.
Okay, got it. I will do that.
Great.
Thank you.
Hey, thank you.
Thank you.
Have a great night.
Okay, and I don't think anybody else is on,
All right.
so,
So moving on to new business, open up discussion on
yeah.
body art regulations.
Yes, so we'll open a public hearing for the development of body art regulations, and that is at 6:37 or
Right.
6:34. Doesn't look like there's anybody here to discuss body art, so we probably could.
Move to close. Public hearing. All right, vote.
And did everybody vote in favor of opening the
Yes, we
public
did.
meeting?
Oh, yes.
Okay.
All right.
No dissenters.
Yeah. So, and so. Did you guys read it? Any issues?
The
Yeah.
information packet that we were given a couple of weeks ago.
Right,
I managed to, yeah.
Yes, so does anybody have any questions on these? There's another copy here if you have any questions. It's the development of body art regulations is basically just to regulate unlicensed personnel that are doing body work.
Right.
And we would develop a permit through the Greenfield Health Department so that we make sure that everyone has had a criminal background check, that they're using, that they're cleaning their sheets between washes, between clients, that it's not set up for human trafficking and things like that.
Yeah. I thought it was good.
And we did notify the one bodywork practitioner building. It's on Main Street. And we notified them that we were doing these regulations and we gave them a copy. We told them about the Board of Health meeting and we had them sign saying that they got a copy of these.
Right.
And we got a lot of this information from one of the other towns locally that has the
Yes,
policy in
I
place?
copied these from one of the towns out east.
Okay.
What type of fee would it be for the license?
You guys get to decide that.
Oh.
So Mike, do you remember what body art is under? Is it 75, 150?
Body Art's split into a couple things. It's the permit itself to operate a facility, but then we also have body art practitioners, which are the people that work in the facility. I can look it up real quick. But
And-
yeah, so it is split differently though between the facility.
So it's like a fee for the facility, then each
That's how it is for
practitioner?
yeah, for tattoo places.
I would say you can either do it that way or you can do it just by the facility itself. But we do have, I believe there's a part in there where they have to get some training. So with the training, would be coming certificates from these people that did training. So there is a way that you could do, licensing of individuals. I would honestly maybe lead that way just due to the fact that licensing individuals kind of, it will kind of help with the human trafficking issue of people kind of coming in and out all the time that aren't licensed or that were renewing licenses because from what I've seen, it's usually revolving staff. And that's the issue that we find. The staff is always revolving. It's always different people. They're all coming from different areas. So I think adding that each staff has to have a license would kind of force them to stay in the same area in the same towns.
And just for the record, we have not noticed any trafficking or anything like that at this facility. This is just prevented in the future for any place in Greenfield.
Yeah,
And-
so the whole ordinance itself is kind of under a preventive measure, basically just because body art has been a loophole in the state system of regulation. So we're just trying to close that loophole of places that they don't really see any inspections, they don't get any kind of licensing. It's kind of just been a free-for-all for some places that have these that just pop up and they just kind of operate without any impunity from any kind of boards or anybody else to do any oversight. Like I said, there is certain stuff when it comes to massage parlors and doing massages themselves, but I've worked with a inspector from the massage board before, and there's few of them, and they can only get out so much, and they have to regulate by a certain specific rules of massages either taking place where they can see them or massages being advertised. But again, with a lot of these places, that's not how it works. They know those regulations and they work around them. So this is to kind of close those loopholes on those. So we have body art establishment is $180 and the body art practitioner is $125. Now you got to remember again, that's for tattooing and actual skin puncturing, which they do a lot more extensive training. So that's probably why those numbers are kind of high, because they are doing something more extensive than just massages or body work, as we're calling it, body. So, I mean, you could lower them, you could keep them the same. I just want to make you aware that, yeah, they're doing a little more extensive stuff.
Awesome.
Okay.
I mean, yeah, just like I don't think it's crazy excessive. I don't know, maybe if it needs to be as high, I don't know, yeah.
Like, should we think about like 150 for facility, 75 for practitioner?
Yeah.
Yeah, that could be fine too. Is it renewing every year, 2 years?
Every
We
year.
Every year?
We do renewals every year.
Well,
Okay.
I'm more inclined to make it lower if it's a yearly thing.
50?
Yeah. Well, no, as in like I agree.
Oh,
with
like the
75.
75.
Yeah,
Yeah,
and
yeah.
the tattoo. And I think that what you're saying, Michael, is right. I mean, with the tattoo artist, I'm sure there's more, it's more rigorous to
Yeah.
get.
They have to have some college level courses, a lot more blood pathogen training, things like that. So they're definitely better trained, which costs them money themselves. But I think the price is higher because you know,
I would
we need to
imagine.
meet a certain standard. Here the standard's a little lower, but
Right.
like I said, we're going to have some training. So I think it would still be good to have practitioners be licensed as well.
Yeah, that makes sense.
Yeah.
Okay. Well, I think I'm going to make a motion to accept the body work regulation draft as the regulation and put it at 150 for facility and 75 for individual.
Yeah, I'll second that.
Right, votes.
We're gonna do some fee work in the next couple of weeks too, so we can like codify that when we vote on fees too, because we're gonna add some fees and we're gonna and kind of condense some of ours. We did up them with some of the last Board of Health, but we kind of want to strategize to get them more condensed into what really we need. So we'll be doing some work with that, so we can definitely vote that in as well at that time.
Okay. Cool. Right, so that passed.
Summary from me. So we have had 6 vaccine clinics within our PHE program. They've been sponsored by Stop and Shop and Walgreens. And then we did one in Deerfield with just our public health nurses with the stock that we were able to purchase. All of them had great attendance. Shutesbury and Leverett, they did one together, and that one had almost 100 people, I think. So that, I think that one is the busiest because they don't have access like we do. In Greenfield, you can go to any pharmacy to get your vaccines where they don't have the access. So it was perfect for the rural communities. It was perfect for everybody, but especially for our rural communities.
Were they seasonal or childhood or both?
They did everything.
Oh,
Including anything that they may have needed. So if they needed a varicella or something like that, they offered that there. I don't think anybody needed it, but they brought it with them. So yeah, and the same one we did, Stop and Shop did one at our senior center and also offered like pneumococcal and, you know, all sorts of, you could get anything you wanted that day pretty much. We are starting a blood pressure monitoring equipment lending program through the AHA. So at our local libraries, people will be able to borrow blood pressure cuffs. Some of the libraries will have a big blood pressure monitor like they have at CVS where you can just stick your arm in. There'll be information there that people can pick up with, you know, information that says if it's above this range, go see your public health nurse, call us, or make an appointment with your primary doctor, things like that. So that, I think that's going to be great for especially the rural communities because they don't have access. I did a Stop the Bleed training program at Frontier Regional School. We gave out first aid kits with tourniquets and splints and things like that to all the kids. It went really well. I'm hoping that we can do something like that in Greenfield. I'm not sure if the schools have a CPR first aid program, but if they do, then that would be great. Maybe you can connect me if they do. And we haven't had a lot for communicable diseases. We haven't had any except for COVID. Flu is not here, or at least not in Maven, so no Greenfield residents have lab tested positive for flu yet. COVID, we just got a cluster at one of our long-term care facilities. I believe they have 11 people that tested positive. I can't remember if you were all here the last time we had an issue with one of our other long-term care facilities where it wasn't getting reported on time. This one, I didn't find out for at least 10 days after. They didn't put anytime you get a positive case, you need to report it within 24 hours. It needs to get into Casetivity, so it comes into Maven. And one of the administrators was on vacation and it didn't get done until I found out about it yesterday. So I think that we may need to send a letter of reminders that this is required and that there are fines, that if you don't comply with the law that you.
It's not the same facility.
It's the different one.
Okay.
Yeah, we have had issues with this other facility in the past. I've reminded them, but it wasn't as frequent as the first facility. So if it's okay with you guys, I will send a letter just as a reminder that they're.
better to do it at the start of the flu season.
Right.
Yeah.
Yeah.
Oh, another thing is the DPH just sent us respiratory swabs. So if there is an outbreak, we'll be able to sequence for flu and COVID variants and send them right back to the DPH. So they sent us 4 kits that I can keep in my refrigerator. And yeah, that's something new. We weren't, if it was a program before, we weren't involved in it, and now we are.
That's awesome.
Yeah.
All right, good.
Mike, did you want to talk about any open cases?
So the only two open housing cases I currently have are 46 Turners Falls Road and 290 Deerfield, which I've been working on. 290 Deerfield, we went in for a hearing on Friday. The judge didn't appoint a receiver. He did get a fence up around the back of the property. He did submit a plan for rehab. I don't believe the building inspector has accepted it yet, but he is going to resubmit a plan. So the court gave him some more time to work on it. So we're gonna go till December probably. Hopefully you can get a demolition permit in or for the back of the building and then get some rehab plans in for the front of it. 46 Turners Falls Road, that actually turned out good because the lady has been talking about selling it for a number of years, but nothing's really happened about it. There was a house up around the turn going into Turner's where you go over the bridge on the canal there. It had a bunch of shipping containers out front, and she kind of bought the house just to put stuff in it. So they've been cleaning at that. They've gotten a lot of the shipping containers out of there. She has a purchase and a sale agreement for the end of November. Megan went up and did an inspection about a month ago. They made good progress on the outside, so they're working on cleaning the inside. I have been reassured by the purchaser that he will clean up anything else that is around, and he will work to get the house into compliance and rehabable, so somebody can inhabit it. So he is aware that the order will transfer with him when he does buy it. It doesn't go away, so he still will have an order on the house to, it's still condemned, so he'll have to bring it into rehab shape. So he plans on rehabbing the whole house. So hopefully that happens. But that's good. So getting it into court made her move along and sell it. So hopefully that will move along on its own, and we won't have to do any more court dates or appoint a receiver. So those are the two I had out right now. The other one I had is actually in Leverett, so nothing you guys got to worry about. So I think we're good for right now. But it's good to get one hopefully sold and back on the taxes. So it's a plus. Takes a while with some of these, so it's good to get any forward movement.
I just thought of one more case that I had, 449 Country Club Road. It was it was run by, I believe, ServiceNet. It was a group home and it's licensed for 4 bedrooms, the Title V. But when I went in there for the inspection, there were 6 bedrooms, what the state and what the DEP considers 6 bedrooms. It has to be over 70 square size window and a door. They were using them as offices, but they were going to sell the property. So I let the new buyers know that they have to make it back into a 4-bedroom or upgrade the system. So they are choosing to take out 2 of the windows. If they take out 2 of the windows, it can't be used as a bedroom, and they're going to remediate it that way. And the system hadn't been used in several months. So they're also going to do a repeat Title V when it's been in use for 6 months. And they have promised me that they're going to take better care of the system and not flush things like wipes and gloves and things like that. Yes. And I think that was all I had for housing. And then Mike wanted us to read that statement about the.
So the Lunt building that we talked about, 298 Federal at the last meeting. So it is owned by the city. So the city is the current property owner of the property. It's obviously being leased, but as the property owner, we obviously have rights to go inside the building whenever we deem necessary. We just got to give proper notice. So I've just written up a little order just requiring pretty much the city for now, because we're the owners, to do the air quality testing inside at any of the buildings that are deemed necessary by the tester or the board, and that we will conduct the air quality testing through the winter months, because that's kind of the only acceptable air quality testing time is when everything's closed up and there's no ventilation really. So I made it from November to April that we can do testing in those buildings. And since we own the buildings, I didn't go as far as saying if the building sells that we will continue doing testing. I just left it as we will reassess at the time of sale if testing is further required, and we can certainly make a regulation at that point to do further testing. But for right now, I just kind of want to get the language and everything on record that we're requiring testing in that building during those months while the city owns it. So that's kind of the paper I gave you, just a little statement to read, and then you guys can vote on it.
All right, so here's a statement. So the Greenfield Board of Health is requiring that indoor air testing be conducted at 298 Federal Street in all buildings that are identified by the testing company or board. Facilities will be tested between November and March until the city of Greenfield no longer owns the property. At the time of change of ownership, the board will revisit if any continued testing needs to occur. So, move to accept this statement. All right, vote. Pass unanimously. All right.
And then I will get in touch with the LSP for the city, Dan, or Lyons Witten, and he will conduct the air testing, and the mayor assured me that we will come up with the funding source for that. So hopefully that can happen, hopefully in November. I think he planned on trying to go down there. So hopefully we'll get some results by December.
And we talked about this last time, but where are they going to be posted? How are the results going to be?
So we have the PIP, the group that came in last time and
Right.
presented, they have a page on the city's website for the public involvement. So we will post all results there so the public can see the results at the same time we get them.
Okay. Right. And what frequency are we going to be checking the monitors?
I'll have to check with the LSP Lyons Witten. He's the expert in the air testing, so
Okay.
I will check with him how many times he wants to do it. I mean, it might be identified by, what he comes up with the results in the first one. Does it need, follow-up testing faster, or can he wait a little longer?
Right.
So I guess we'll kind of have to go by the first results, but as soon as I get them and we get them up there and everything's squared away, we'll definitely meet on that and we can discuss that as well.
Cool. Awesome. Thank you. All right.
I don't think I have anything else.
All right. So old business, we have anything outstanding? I mean, took care of this. All right.
You've nothing about vapes or cigarettes?
Hopefully not.
Not right now. Yeah,
Not
no.
recently.
Oh, the Whippet stuff.
Yeah.
Yeah, we did have that.
Yeah.
I'm not sure where we got on that, Megan. I don't believe I've heard from the chief or anything on any of.
I have been working with Officer Haskins. I will give him a call tomorrow to get an update on where we are with that.
Yeah, and then we are going to kind of draft up some regulations that we can get out to you, probably at the next meeting. We can come up with something.
I think it's just with the flavored nitrous oxide.
Yeah, or just nitrous oxide
So
in
it's-
general.
Yeah,
Convenience
not only
stores.
flavor.
Pharmacies.
Not only
food
flavor,
grade.
no.
I
We're-
didn't know you could flavor it.
Neither do I.
Yeah. Oh.
Neither do
Learning all
I.
sorts of new. And when there's violations, the tobacco control board would notifies us, right?
For normal yes, for tobacco and vapes, yes,
Yeah.
they would notify us
Okay,
when
so
there's a
we haven't
violation.
had any-
No, they only go out a couple times a year.
Okay,
So it's very likely.
Yeah.
I can guarantee they have not been out
Okay.
since the last time that we chatted.
all right.
And then, yeah.
They tell me right away when they go out.
If we do this ordinance too, it will only be enforced by us. It will just be a local ordinance on the nitrous.
Okay.
So it'd be something our Greenfield inspectors would enforce, and we would do all the follow-up and penalties.
Did they follow up? Do we know what like if the card reader was installed in another business or?
Oh, we have not followed up on that. I
Yeah.
will send out an inspector tomorrow to make sure it's there.
Yeah.
Because they were also doing the suspension and like.
Yeah, they were
They did a
2
chunk,
weeks and then
Then
a
a
week.
break
Yeah,
and
yeah.
another chunk of it.
Mhm. Yeah,
He did the suspension time. We did follow on that.
yeah, we did, yeah, he did the
Alright.
suspension, but I did not check to see if he did the card reader, and I don't think any of us have checked, so we will definitely follow up on that.
Yep, we can send someone over there tomorrow.
All right, other things, good old business? All right,
No, I think next time we'll revisit the fee schedule. I think we need to start charging for inspections, for when we go out for repeat inspections. We'll have to put that on the agenda for next time and we'll talk about it, but just so that, it gives us more weight, you know, right now our only recourse is going to court.
Right.
Where if we had fines, that might help us out a little bit
Yeah.
in getting compliance with some of the.
That sounds good.
So the town has pushed forward with, it's a law called 40U, and it allows you to take, non-criminal fines, civil penalties for certain things. And, if they go unpaid, you can tack them onto the taxes. So
That's
it,
good.
it gives us a little more leeway instead of people just being like, I'm not paying it, nothing's gonna happen. Well, you gotta pay your taxes. It goes on that. So there's really no way of getting out of paying it.
Yeah, that's good. All right, cool.
Okay.
All right.
Oh, and next meeting, when do we want it?
Anything suits me.
Yeah, just about anything.
Okay, so the third Wednesday would be, do we do third or fourth? Fourth, I
We can do
guess.
either way, so.
Do anything.
Well, then-
Nine.
Fourth would be the day before Thanksgiving. You probably don't
Yeah,
want to do
yes,
that one.
yeah. Let's go to the 19th.
19th,
Yeah,
All right.
19th at 6:30. Is that good for you, Mike?
That works for me.
Okay.
All right, cool.
Did we have any other big things we wanted to touch on for like the year's end? I can't remember. I know,
Yeah, we had some,
I thought Mike had outlined, I think, some general topics we were going to touch on, but I don't know if there's anything big we're missing before the end of the calendar year.
I think our biggest thing was getting the body art, which we did.
Okay.
right. And then you're gonna come back once the regulations for like indoor use.
We're
That
gonna,
was
we're
good.
gonna
Yeah,
see
the
how
indoor
that goes.
consumption.
Once they codify the regulations for recreational use, for like coffee shops and indoor food establishments and things like that. Once I get some codified regulations from the state on that, we can definitely look into that and start digging into those. and see what
Cannabis.
we wanna do.
Yeah.
Yeah. So the
Yeah.
Cannabis Control Commission, I believe I believe they stopped open comment not too long ago. So I believe from there, it's now gonna go to the legislatures. So I'm guessing in the next session or two, those will start going through. And then once they vote on all that and we get the final regulation, we can definitely start going through that because like I said, a lot of that's gonna fall to options on the city on what they want to do with certain things. So we can definitely dig into that. But yeah, right now I wanted to get the body art work done before the season's over. And then, yeah, I think that was the biggest one for right now. And then we can dig
Okay.
into the other ones.
Well, I know we were talking about that, and like you kind of brought up the idea of bringing in, after the Lunt presentation.
Yeah.
Right, we were gonna bring in,
Well, I had mentioned something about like the company,
right,
I mean, getting on the record and saying what's going on, why haven't they released a report or anything like
Right.
that. But I mean,
if that's,
I don't
So
know,
do-
like it's not like I can subpoena someone and say, come and testify or.
yeah.
No, so DEP's working on that right now. I would say we wait until we get some air quality testing because if I think if that's going to stir up anything, if we get some bad results there or something, then I think we should bring in the leases and kind of talk to them. I mean, one of the leases is the state because they do programs over there.
Mhm.
In the building, I think that probably might have the issues is actually occupied by some state agencies. But there is a leasee, Rayford Pellegrino, that does lease the entire property and then subleases it to these other groups.
Mhm.
So if we ever feel like, we need to bring him in, we certainly can send out a letter and request that he appear at a meeting. I don't think he'd have any issue with that. He was pretty forthcoming when we had our meeting at DEP. Right now, they're reviewing the plan that was submitted. So when I get some results from that, because the results are either going to be that they're requiring more testing to happen at the site, or they're going to start with phase 3, which is they're going to recommend what needs to be done to clean up the site, or if it's cleaned up enough. So they're reviewing that plan now. They did say they'd probably have it by year's end to us, the results. So as soon as I can get that, we can definitely have more discussions on that too.
sounds good,
All right.
all right. All right, move to adjourn. Meeting is adjourned.